welcome to our lower leg dysfunction care path. There are 4 parts to each of these care paths. The first one is get adjusted. Not only will an adjustment clear the nervous system and speed the body's ability to heal, but it will also increase the movement of the joint, which will allow the other 3 parts of the care path to happen. Second part, stretching out tight muscles. Third part is strengthening weak muscles. Fourth part is integrating the whole shebang together. But we want to make sure that parts 2 and 3 have happened for at least 2 weeks before we start adding in part 4. Stretching, there's a couple guidelines for stretching. We want to make sure that we hold it for 10 seconds. We want to repeat that 3 times. We want to do them twice daily. We want to make sure that the stretch is uncomfortable but not painful. If anything hurts while doing the exercises, please stop immediately. First stretch that we're going to talk about is for the outside of your calf. It's going to be very similar to what you're familiar with in terms of a calf stretch. Just like you were leaning up against the wall, the leg comes back out to the side about a half a step, turning the pinky toe in and press through the outside of the heel. With our hip flexor stretch, we want to go through 3 separate modifications with the stretch. So we start off in the lunge position. The knee always stays in back of the toe, with the rear toe pointed with the first modification. Now it's important here that we do a pelvic tilt in order to engage the muscle. A lot of people, what they'll do is drift forward like this. I don't want you doing that. I want you to be straight up and down, pelvic tilt under, feel the stretch right in the front. Second modification, up on the toe in the back, pelvic tilt under, feel the stretch down the entire thigh, all the way to the knee. Third modification, point the toe in the back, bring the toe over and back of the other foot about 30 degrees on an angle. As you pelvic tilt again, you feel it here on the outside. If you need more stretch for any of these, you just want to simply drift forward, but only an inch or 2. Outside hamstring stretch. We're going to be laying on our back. Knee comes up. We're going to grab the outside of our thigh muscle, feeling the cord of our hamstring on the outside. You're going to extend the leg and then pull the leg toward the opposite shoulder. So you think of your foot going over your opposite shoulder. There's also a couple of guidelines with the strength training exercises. First one, the body part needs to be moving at a cadence of 2-2-4. That's 2 seconds exertion, a 2-second hold at the top, and a 4-second release. The second guideline is that we're doing it once a day for 10 to 20 repetitions for each exercise. The anterior tibialis exercise is going to stabilize the front of our ankle joint. What we want to do is line our heel up with our toe of the opposite foot. Turn the foot in like it was being twisted. Curl the toes and simply rock back on the heel. For our posterior tibialis exercise, what we want to be doing is standing at an arm's length from the corner of a wall. We're going to bring our foot closest to the corner, about 1/3 of the way back toward that corner, turning the pinky toe in, lifting the opposite foot, cueing to make sure that we're not leaning here. We're still straight up and down, like the Leaning Tower of Pisa. We're going to be pushing through the ball of the foot. For the glute maximus exercise, we're going to be laying on our belly. For the first part of the exercise, we want to suck our navel to our spine, engaging our abs, stabilizing our lower back. With the toe pointed, we want to slightly flex the knee, bring the knee close to the other knee, and then extend. When we overextend, this is where we start feeling it in our lower back. For our glute medius exercise, what we want to be doing is laying up against the wall. There are two progressions with this exercise. First of all, both cheeks on the wall, both feet on the wall. Hand can come right under the head. And what we want to do is simply open as wide as we can, and then slowly come back down. When you can reach 20 reps without any effort, then we're going to move to the straight leg modification. Leg is slightly turned out, and we're going to drag the heel up the wall and back down. For our single leg balance exercise with reach, there's two parts. The first one, we want to be able to balance on one foot for a minute. First, we want to cue the foot that we're going to be standing on so it has a nice high arch, and we want to maintain that arch throughout the full movement. We're going to curl our toes under and then just place our foot down, pressing through the ball of our foot. Now, the first part of it is just lifting the opposite foot and trying to maintain the position where you're not leaning too far one way. We want to try to stay in alignment with our hips and shoulders in alignment, leaning as little as possible. Pushing through the bottom of our foot, the ball of our foot. Once we have this position down and we can hold it for a full minute, then we can move into a clock face exercise where we're cueing our foot to maintain that arch, pushing through the ball, and then taking our toe and touching to 12 o'clock, and 11 o'clock, and 10 o'clock, and 9 o'clock, and so on and so forth throughout the whole half of the clock. So from 12 o'clock to 6 o'clock, and then the same thing on the other side from 12 o'clock to 6 o'clock. We want to add challenge to it. We want to do 5 reps in a row around the clock, and then 5 reps in a row along the clock this way as well. For the single leg deadlift with touchdown, we are going to start off the same way as we did with the single leg balance. Cueing the arch in our foot, pushing through the ball of our foot, and simply with the opposite hand, we're going to touch the foot that is down.